Run, river, run, run through the hills. Run, river, run to the sea. Run, river, run to your place beneath the sun. Run, river, run over me.
Hi, this is Jan Lewis. Welcome to be my guest. Today we have from UMass Medical School, right? We have Tina Grosowski, and she is, I hope I get this right, and she will correct me if I'm wrong. She is the project coordinator for the Central Mass Tobacco-Free Community, and she's going to talk today about the dangers of vaping, the vaping epidemic. I have a young one who's vaping, and I'd love to see him get rid of the thing. Welcome.
Thank you so much for having me.
Oh, how long have you been doing this?
So I've been at UMass for about 6 years, and then before that I worked up in the town of Westford for 10 years, and before that other places doing substance abuse prevention.
Yeah.
And I'm really excited to be here, and I've gotten to know people in this area, Upton, Mendon, and so thank you for having me.
You're welcome. She says that she's been at the Blackstone Valley Tech, at our Nipmuc Region High School, and at Memorial School, our
Mendon Middle School.
Mendon Middle School too. How did they hear about you?
Well, I'm not sure exactly. I made a connection through the school nurse at Nipmuc High School, Leslie McGinnis. She's fantastic, and I've been there talking to the staff, and then at the Blackstone Regional Tech School, working with the vice principal there. We had an evening for parents. And then up at the middle school, also an evening for parents. So the parents could learn, get more familiar with the products, which I can show you today, and learn more about how the industry is targeting their young children with tactics to get kids hooked on nicotine.
I read about you, Tina, in the one of the health magazines that comes out in Worcester. What was the name of it?
Is it the Worcester District Medical Society?
I think that was it. And as soon as I saw the article about you and the vaping, I said, I've got to get her on, because it's, everywhere I look, it's either this or this the kids are doing. Show us, as people who don't know what we're talking about, show us some of this. It's called Juul, right?
Well, you're right. Juul is the most technologically savvy of the new products. All electronic cigarettes have a battery in them, and then they have a cartridge with nicotine in a substance called propylene glycol.
Is that the flavored thing?
So this is called the flavor pod with the Juul. And the Juul is really high-tech. It looks like a flash drive. The flavor pod looks like a flash drive. And then it also comes with a charger that's magnetized, so you slip it into the charger and then you put it into your laptop or computer so you can charge it up. Once it's charged up, then you insert the flavor pod, again with the nicotine in the propylene glycol, and then you just inhale on it. The problem is several things. One is that the propylene glycol itself is like a vegetable oil, like when you use spray pan on your skillet when you cook. And when it's heated up, it releases trace chemicals like benzene and formaldehyde. And then you're inhaling the aerosolized oil. So we use propylene glycol in junk foods or potato chips, and you digest it because you have acid in your stomach. But there's no acid in your lungs. So the oil is going down into your lungs in this fine aerosol, and eventually it starts building up and can cause respiratory infections and pneumonias. So we really want people to understand this is not water vapor. This is an aerosolized heated oil. The second part is that is where they get the flavors. So there's many different flavors of the Juul and other electronic cigarettes. These are the flavor pods. This green one is probably mint.
Hold it up a little bit. Yeah, there you go, Tina.
This is, there's used to be 4 of them in here. This is probably a mint flavor with the green, which is very popular among young people. And this flavor has a red cap on it, so it was probably cherry or strawberry. Again, flavors that are really enticing to young people. And the flavoring, as I say, is this is not fresh strawberry jam or fresh mango juice from Market Basket. This is a chemical called diacetyl. Diacetyl used to be used in the microwave popcorn industry until they discovered the workers were starting to get sick with, again, respiratory infections and pneumonias, where they realized from the research that it was the heated diacetyl, which is the chemical that makes that incredible buttery flavor on microwave popcorn, was causing infections in the workers. So the FDA came in and they said you can't use diacetyl anymore in microwave popcorn.
Oh.
But where are they using it now? They're using it in all these electronic cigarette devices.
And yet kids are using this, getting sucked in, thinking it's better for you, healthier for you than a cigarette.
That's right. So we say they're less harmful than combustible cigarettes because there's nothing more harmful than combustible cigarettes.
Yeah.
But they're not harmless. And again, it's the heated diacetyl and the heated propylene glycol that's a problem. Now in schools, this is very disguisable. That's the other thing that makes it so high-tech.
Yeah.
It's very easy to think that this is a flash drive for teachers. That's why we've been doing so much education. And young people can use them right in the back of class or certainly in the bathrooms. The other problem is that the Juul is very high-tech in that the nicotine that's in these flavor pods is called nicotine salts, which is a formulation that goes to the brain really quickly. And when you inhale it, it's very smooth in your throat, so it doesn't provide any bitterness or anything that would be discouraging to young people. And finally, each of these flavor pods is worth the same amount of nicotine as a pack of cigarettes.
A pack of cigarettes. One of the pods.
Right. And kids tell us that they go through at least a pod during a day and sometimes into a second pod in the evening.
So it's easy to get addicted to it. Very, right?
It's very easy, especially for adolescents, because their brains are still growing. And when the nicotine adheres to the neurotransmitters and fires off the receptors in the reward system of the brain, then it is easy for young people to get addicted because it forms a pathway of addiction. And it doesn't take more than 3 or 4 times trying it where the brain learns to become addicted to it.
It's expensive. How do the kids afford this, though?
Well, that's a good question. So up until Christmas time, any child could go on the Juul website or on Amazon or any of the other online sales, put in a birth date and a card number, like a gift card number, and put in their address, and the starter kit would get shipped to their house. If mom's at work or dad's at work and the child can sign for it, then they've got the kit. Now, online, they were anywhere between $20, $25, $30, but with a gift card, you've gotten a gift card for your birthday or Christmas time from grandma or mom and dad, then you can use your gift card to buy these.
What would be the gift card's
kits.
name? What would it be for?
Any kind of gift card, a Visa gift card or an Amazon gift card.
So it's like a credit card for the kids.
Right. It's
Okay.
not a credit card, just a gift card.
It's a gift card, yeah.
Like a gift card.
How much is it, though, when they do it, when they finally go out on their own? I've never watched my son look at the price. I can't even stand to watch them buy it.
Mm-hmm. So, again, usually, it can be anywhere between $15, $20, $25. So there's a wide variety, and many of the stores offer coupons. And that was another way to bring price down, especially for young teens who have their lunch money or one of these gift cards. Then they could go online and easily buy these products. They also sell them in the convenience stores, unless a town has adopted a local regulation, and I'll talk about that in a little while.
Right up the street they're selling it.
Yeah. So that was up until Christmas time. So the FDA in December did recognize that there was an epidemic. And they said now that they've cut off all online sales from these stores online. So Juul is no longer accessible unless you have age verification and you have an actual credit card, not a gift card. The same is true for Amazon. Our own Attorney General here in Massachusetts, who's so great, Maura Healey, has shut down all online sales companies here in Massachusetts. So that's a really good thing. Now the FDA is proposing to cut off all convenience store sales of all these flavored products. But we'll see what they actually end up doing. Now in Massachusetts, because we have strong local boards of health, many boards of health have passed local regulations to restrict the access for tobacco for young children. So one of them you may have heard of is raising the age to 21. Another one is a pharmacy ban. And enough towns passed those regulations that now, this past summer, the legislators voted to have those be a bill and then pass it as a law. So now they're statewide laws, starting this past January 1st. You have to be 21 to buy any tobacco products. That includes all these flavors products and smokeless products, etc. And no pharmacy in all of Massachusetts can sell any tobacco products. That includes pharmacies in the stores like BJ's or Costco or Walmart. So those are two strong youth access regulations, we call them, that were started at a local level, and now they're statewide.
Yeah.
The next local regulation that over 144 communities have passed is called the flavor restriction. The flavor restriction gets all these flavored products out of the convenience stores and the gas stations and the mini marts, and you can only sell them in a vape shop where you have to be 21 to even go in.
Yep.
Or a tobacconist, and there's not too many tobacconists left anymore. There are a few. So those are the restrictions that we hope are going to reduce the access to these products for young people, especially under the age of 21, when their brains are
why do they think,
still
Tina,
developing.
why do they think that they were led to believe that this was, if you're trying to stop cigarettes, that this is healthier for you, but it is not?
That's right. So the Juul company, as well as the other electronic cigarettes manufacturers, started their businesses to help adults quit smoking.
Yeah.
But when you're an adult, what we say even to quit smoking, there's FDA-approved research and process which uses the gum or the patch or medications, plus counseling. Counseling is really important to quit because nicotine is the strongest drug that there is. It's very hard to quit. So even if you switch to electronic cigarettes, we say, well, that's great. You've gotten off combustible cigarettes. But then you're hooked on the nicotine in the electronic cigarettes. And that's really hard to quit because you have to know how to reduce down. And since these products are not regulated, you don't know how much nicotine is in each one of them. It may say it has 15 milligrams or 7 milligrams, but how do you know that's really true? Because they're not regulated. As bad as cigarettes are for you, the government regulates them, and each cigarette is exactly the same as the next cigarette in the pack, and then the same pack is the same of all the packs in a cartridge because they're tested every week. So, again, the FDA is proposing to regulate, proposing to stop the sale in stores, and we hope they do. Yeah. But in Massachusetts, we're not waiting, and many, many towns have passed the flavor restriction.
Tina, how can people get a hold of you if they have questions?
So I work at UMass Medical School, and anybody can give me a call if they're interested in more information about this. My number is 508-856-5067, and you can always send me an email at tina.grosowski, GROSOWSKY, @umassmed.edu. We also want to let people know, and I'm sure you'll show at the bottom of your screen after, about the new website the State Department of Public Health has put online now called Get Outraged. So it's getoutraged.org.
Yes.
www.getoutraged.org.
Yeah, she's brought a wonderful flyer. Can you spare this flyer?
Yes, it's for you.
Because downstairs, if you want to come over to the Upton Library, it'll be up here, how you can reach at getoutraged.org about this latest menace we have, and our kids are falling for it hook, line, and sinker. I mean, look at it, the way it's designed. My kid is a millennial. Their minds are always on gadgets like this. So naturally, he's going to take right to it and think, well, I guess I'm going to quit smoking. But I heard that recently some young guy had a vape blow up in his face.
Yes.
What happened, Tina?
Yes. Well, it has a battery. Any product that has a battery has the potential for, being self-destructive. The battery can blow up. And we have seen several reports of people around the country having their device explode. People have gotten holes in their cheeks, have had their teeth knocked out. There was a woman with one in a charger in her car. It ejected on its own out of the charger, went to the back seat. It got lodged in her child's car seat, between the car seat and the child's leg. It got a third-degree burn on the leg. So, again, these products are not tested, so we don't know, the extent of it. The other piece that you were talking about before is that we don't know the long-term effect of these devices. We know the long-term effect of combustible tobacco. We've seen high rates of smoking, and then, especially in Central Mass, high rates of tobacco-related illnesses. But we don't have the research yet on these products long-term because they're new.
Mm-hmm.
So as I mentioned before, in the short term, we know they cause respiratory infections or pneumonias, and we don't know the long-term effect yet.
A lot of our kids
these.
are guinea pigs right now, basically.
That's right, because the industry is targeting them with these products to start on nicotine, and research shows that it's possible that once you start using this product and getting your brain is addicted to nicotine, then you could go on later in college, to use combustible cigarettes, which we don't want to see our young people doing, of course. Mm-hmm. So the industry now has bought the Juul company. 35% of Juul is now owned by Philip Morris, which is a well-known big tobacco company.
Yeah.
And that gives them product placement on the shelves in other states where there aren't restrictions like the flavor restriction. So it's all the same tactics that the industry used, lots of advertising on social media where young people are, because you can't advertise on television like they did when we were growing up.
Yeah.
So now they're in social media such as Instagram, Snapchat, Twitter.
Where all the kids go.
Where the kids are.
Oh, yeah.
That's right. Making it seem attractive and cool and being part of the in-group or the in-crowd when you use these products.
When you've spoken at the schools locally, do the teachers come up to you after and say, oh my gosh, I see this all the time?
Mm-hmm.
But do they also say, how can I stop it? I mean, you know how kids are. They're not going to listen, right?
Mm-hmm. So we have to, understand two things. One is that how to talk to kids so that they'll listen about these issues, and then how to help them because they're addicted.
Mm-hmm.
So we have on the Get Outraged website, there's lots of tips and tools to help parents and school administrators and teachers learn how to talk to children using the facts, using information about the industry that they're targeting them, about how to get them to understand the industry wants their money, and that's the only reason why the tobacco industry exists is for the shareholders, and not to be tricked by the industry. So it's a message, an educational message.
It's like drug dealing.
An educational message, that's right.
What they're doing.
So the children understand how the industry is targeting them. And then second, understanding the nature of addiction. Mm-hmm. Young people think addiction is what they see on TV or in the movies. And that's not what this looks like, as you say, with the high-tech devices. So they have to understand that if they're using their Juul to go to the bathroom between every class and inhaling it, and then when they, even in the back of class or when they get on the bus or when they get home from school, that's their brain is saying it needs more, it needs more, it needs more. So
is it a stimulant, Tina? Is it a stimulant or a relaxant?
No, it's a stimulant and gets the brain a little bit of a high.
No wonder they like it.
Yeah. So it gives you a little bit of a buzz.
More than a regular cigarette?
Well, certainly the Juul more than a regular cigarette because it's got this formulation of nicotine that goes really quickly to the brain. So again, for young people, a lot of young people are tired, they've been doing their homework, they stay up late listening to music or playing video games, and just having that little burst gives them a kind of energy to get through the day. So we need to teach them about it and make sure they understand the facts. The second important piece is that how to help them when they are addicted. So it used to be when kids were smoking in high schools, there was education for school nurses in smoking cessation. They could get trained, and then they could help their students get through the day without smoking and learn how to deal with the withdrawal and the cravings that come with quitting nicotine. So it doesn't matter whether you're quitting combustibles or whether you're quitting vaping, it's the same thing. So now at UMass Medical School, we're looking into making a follow-up companion manual for school nurses so that they can help their students give up and understand vaping and addiction to vaping. And also having parents and teachers understand that this is an addiction. Children should go see their provider, their pediatrician. And then There's a website called the Truth Initiative. The Truth Initiative was started back in the day with some of the settlement money when the lawyers sued the big tobacco companies.
Right.
And they have a lot of good information on their website, and they've come up with a new texting app. So teens can text a phone number and then get messages directly to them from a trained tobacco treatment specialist about how to get through the day.
That's amazing.
Throughout the day, and get tips and help with their cravings and withdrawals.
Tina, over at UMass, I know there's a research center over there. Are they doing any research now on the real damage? Are they beginning to see the damage done to the kids' lungs with this?
Well, again, it's still so new.
Ugh.
I'm sure that in the next couple of years there will be research starting to be done. There are researchers that have been studying nicotine itself and how that works on the brain. There's researchers studying menthol. Menthol is a protected flavor in the tobacco industry. Back in 2008, the industry wanted to make flavored cigarettes. The government said no, but they let them keep making menthol. Menthol's been used to target different populations of people, and with special brands of cigarettes, and the industry has targeted African Americans, Latino, LGBT, with advertising and brands like Kool and Newport and Salem, and again advertising at jazz festivals, advertising in places that they know this population of people like to go, and then when you talk to smokers in that population, they're using those products. Menthol lets you take in cigarette smoke much deeper into your lungs. So we've seen now over the past 10 years higher rates of lung cancers in those populations that use the menthol products. So it's a racial justice, racial equity issue that the industry is targeting those people with menthol. So the exciting piece about that is that some communities have started to include menthol in their flavor restrictions. The city of Somerville just passed the flavor restriction with menthol included.
On the Juul thing, right?
On all flavored,
on
even including flavored cigarettes, menthol cigarettes.
Wow.
Some other towns are following. They are being sued by local lawyers from the tobacco industry, but there's pro bono lawyers that the state and our program works with to help the the retailers and the town. Really, it's the town of Somerville, city of Somerville. So we knew that the industry would come in for a suit because that's what they do.
Sure.
But we're excited about the city of Somerville, and hope more and more communities will step up when they know that they'll be sued, but that there's lawyers that will help with the suits.
Well, Tina, you've spoken at some of the schools. How can people reach you if they'd like to have you come speak at their school?
Sure. They can, again, email me. They can go to the Get Outraged website because there is a web page for schools. There's a site for communities, and there's a listing of all the community partnerships. So the Central Mass Community Partnership is one of 7 by different regions in the state. So there's one in the Northeast, there's one in Greater Boston. The Central Mass Tobacco Free Community Partnership, and my information is on the Get Outraged website.
And you'll find this right downstairs at the Upton Library, at the huge bulletin boards we have down there. Tina's going to be putting that up for you to see. So there is hope out there. They make it look so attractive to the kids, It looks like candy.
That's right. They are using candy flavors to target young people.
Sour cream? I wouldn't think that would fly, but it does.
Cotton candy, bubble gum, gummy bears, pina colada. These are many of the flavors that are attractive to young people. When you think about our young people today, they're raised on flavored cereals, flavored Jell-O, flavored yogurt, and even medicine. When you have your child has an ear infection, you take them to the pediatrician.
The pink medicine, I remember.
Gives you the amoxicillin,
Yeah.
and that amoxicillin is usually bubblegum flavored or cherry flavored. So kids even learn that medicine is flavored. So if medicine that's supposed to be good for you is flavored, then what could be so bad about these products if they're flavored?
Well, this is also in Spanish, right, on the back?
Yes,
English and Spanish, so if anybody comes into the library or whatever sees this. Is this posted at UMass too, near the cafeteria?
Oh, sure. We have them up, and we have them on the website there, and we have some large posters. Actually, there is one downstairs that I put up back in the fall that's still down on the on the bulletin board downstairs in
I
the
imagine a
library.
lot of our UMass doctors over there are going to be seeing, especially pulmonary. A lot of these kids now, who knows, 5, 10 years from now, are going to start having problems.
Especially the respiratory infections, which
Yeah.
we know can happen in the short term. And that's the reason why we want to spread the truth about these products and dispel the myths so that kids understand the truth, and parents, administrators, school teachers, anybody who's a trusted adult in the community can talk to young people about these products.
We've been talking with Tina Grosowski, right? Beautiful name. And she is the project coordinator over at the UMass Medical School, project coordinator for the Central Mass Tobacco-Free Community Partnership. And she's been talking to us about the dangers of this vaping epidemic. I know I'm a mother too. I've got a kid out there who just, he'll switch between a cigarette and a vape or this and that. If the vape doesn't work out, his intentions were good. I want to quit smoking. So, whoa, everybody else is trying this. So I went into one of those, not to buy it for him, but I brought him into one of those vaping stores. I was curious to know, oh my God, they make it look like...
Like you're going into the Apple store.
Oh, yeah. They know exactly how to advertise this. Tina, one more time, if people want to talk with you, how do they get a hold of you?
So you can certainly call me at 508-856-5067 or send me an email at tina.grosowski, Grosowsky, @umassmed.edu.
Do you have a support group over there at UMass for people trying to quit the vaping?
Well, I wish we did.
Yeah.
What people can do is call the Quit line. It's the 800 number here in Massachusetts, 1-800-QUIT-NOW, which is the free 24-hour quit line, smokers helpline, but they'll talk to anybody about vaping or smoking. Trained tobacco treatment specialist that's available now on the website from either Get Outraged or from MakeSmokingHistory.org, which is the state website. Or you can so you can sign up online going to the Make Smoking History website. So now the treatment specialists are available by email or by texting or by phone.
Do you think, before we close, do you think that there is coming a time when there will actually be detoxes, facilities for people to go, for the both cigarette and the vaping? Do you think there will?
It would be nice if it was accessible to all people to be able to quit, because we know how difficult it is.
Oh, definitely. Tina, thanks so much for being with us. Oh, when I saw that, I said, oh boy, we've got a lot of kids out there. I don't think I've met an adult. I mean, somebody over 30 I haven't seen doing it. Under 30, yeah, but
Yes.
not. I don't know what it is, but I can see where the attraction is with all the cutesy little things, the gadgets and the colors and the flavors. It's like putting a young person, I don't know, it's like a child in a play store, in a toy store, and you take the teen and the young adult in something that they love, and they're gone. They
Yes.
think it's great, and of course the peers are doing it.
Yes, it's sort of like having an iPhone 10 that delivers a hit of nicotine. So it's the
Oh.
latest technology,
Thank
and
you, Tina, for being with us.
Thank you for having me.
You're welcome. We'll see you next time and be my guest.